The double-pronged tongue-based somnoplasty handpiece by Gyrus Corporation is indicated for radiofrequency volume reduction at the tongue base in patients with obstructive sleep apnea. The safety tips guard the dual electrodes, which have proximal insulated 1 centimeter portions and distal 1 centimeter active electrodes that release controlled thermal energy when activated, producing a 1.5 centimeter lesion of tissue ablation deep in the tongue muscle, raising the internal temperature to a controlled 85 degrees centigrade, leading to zonal necrosis and cicatrix formation. Necrosis causing ablation of tissue and volumetric reduction. Cicatrix causing scar contracture and stiffening of the tongue muscles. The unique, gently curved configuration of the handpiece conforms to the hypopharynx and is well suited for treatment deep in the tongue base using the digitally guided imagery technique. Please excuse the play on words. The tongue is not pulled forward at all, but left in its natural position, with the patient intubated under general anesthesia. The index finger or second digit guides the safety tip of the handpiece down to the tongue base, with the needle electrodes safely sheathed, following the endotracheal tube to the epiglottis, palpating for the vallecula and palpating for the hyoid bone anteriorly. As the safety tips are pressed firmly against the tongue base, I try to imagine placing the needle electrodes into the hyoglossus and geniohyoid muscles just anterior encephalad to the hyoid bone. The lingual arteries and nerves and hypoglossal nerves enter the tongue medial to the digastric muscle from inferiorly at the mid-tongue level. The digital imagery guided technique places the active needle electrodes posterior to these important structures, avoiding nerve damage and complications. More anterior placement of the electrodes with the tongue pulled forward can allow the 2 centimeter needle electrode to penetrate through the tongue ventrally into the floor of the mouth, causing subsequent edema and hematoma formation of the subungual mucosa and of the floor of the mouth, leading to airway compromise. Posteriorly, the tongue muscle is thicker and less likely to be penetrated by the needle electrodes. I create anywhere from 5 to 7 double-pronged or 10 to 14 lesions, depending on the tongue size. There is minimal morbidity with the somnoplasty technique.